The carotid arteries are the principal arteries that supply blood to the brain. The vertebral arteries, which sit in the back, also supply blood, but most of the blood to the brain comes from the front, from the carotid arteries, which sit here in the front in the neck. A blockage in the carotid artery can lead to a stroke. Blockages can either break pieces off, which travel up to the brain and cause a stroke, or the blockage can become so severe and so constrictive that it essentially cuts off blood to the brain and causes a stroke, which is a debilitating problem for a patient. A large portion of people with severe blockages are actually asymptomatic, meaning they have not had symptoms of a stroke or problems. It doesn't cause things like headache, it doesn't cause a pain in the neck or anything like that. So oftentimes the first symptom is the stroke that happens. The first step is talking to your primary care physician about your risk factors for atherosclerosis. These same risk factors are also risk factors for heart disease, peripheral arterial disease, and then carotid artery disease. There is a simple, effective, and inexpensive screening test known as a carotid ultrasound, which can be then ordered by your primary care physician if he or she feels like it's warranted. Essentially, there's really three treatment options in my mind. The first and the foundation of all of the treatments is medical therapy, and that's using a blood thinner such as aspirin or Plavix to reduce the clotting of the blood on the carotid blockages. It's use of a high-dose statin class medication. These are medicines that are powerful medicines that lower the cholesterol level in the blood. When patients have severe blockage, then we start thinking about fixing the blockage itself, and that's when the other two options come into play. One is a classic operation, which is a well-known operation that's done thousands and thousands of times in this country every year, called a carotid endarterectomy. And in that operation, the surgeon makes an incision in the neck over the area where the carotid blockage is, places clamps on the carotid to stop the blood flow, and scrapes or cleans out the carotid through a variety of different techniques that surgeon is comfortable with, and then sews things back up. That's a great operation that works very well, and it's a good operation for many people. So the way TCAR works, or it stands for transcarotid artery revascularization, it's putting the stent in through a small incision at the base of the neck. After that incision is made, a second catheter is put down in the femoral vein, and those two are hooked together, so now blood flow, while the stent is being put in, instead of going up towards the brain, is coming down the opposite direction from the brain out to the femoral artery. The advantage of that, or the elegance of that, is that any blockage that's knocked off, anything that doesn't go right in terms of getting across that blockage or getting the stent in, those debris, instead of traveling to the brain and causing a stroke, are simply sucked down in this reversed flow, vacuumed down, if you will, into a filter, and that blood is returned back to the patient in the femoral vein. And it makes it an exceedingly safe procedure. The advantages of TCAR that we find most patients are excited about is that it's done through a very small incision, often with a local anesthetic, with a very minimal recovery. Sort of a one-night stay in the hospital where patients really feel fantastic later the day after it's done. And I'd say now that TCAR is my preferred way of taking care of carotid disease, as long as the patient has the right anatomy and carotid setup to have that procedure done.